Physical therapy is very interesting to me, and I've always been involved and excelled in the sciences, and so through undergraduate school that was a natural course of action, and it ended up between medicine and physical therapy, and I have an older brother that went into medicine before me, so I decided to take a different course of action. And we both ended up in neurology, but just through different courses. So I don't know, I enjoy therapy. You get to treat the problem and fix the mechanics, and the musculoskeletal field is the biggest draw to me. So that's probably the major reason I came into therapy. Treating multiple sclerosis it takes very skilled and patience, and I think there's major aspects that we do different. Is one, we developed our own scale. We're actively working to progress the field, and the big thing is not attributing all symptoms to multiple sclerosis. Most people walking around in our society today have movement dysfunctions, and they have disuse atrophy from just not using muscles the way they're designed to be moved, I guess. Some muscles, for example, like your biceps, work against gravity, where other muscles, like your triceps, work with gravity. So over the course of living your normal daily life, the biceps is going to be stronger than the triceps. So you develop muscle imbalance, which leads to faulty movement patterns, okay, and eventually pain. Well, MS patients still have these same faulty movement patterns, and in a sense we can correct their techniques and get all of the muscles distributing the force loads, or getting them out of a chair, however you want to say that, and it helps with energy conservation because more of the muscles are doing their job. And you also can improve balance because you get everything in the system functioning to its optimal level. The other thing we can do is to get the neurological system working efficiently, and as efficiently as it can possibly work. So we want what is working very well. We started an exercise program for our multiple sclerosis patients, and I don't want to get too technical, but if you read through research, we see that patients who have physical therapy, I guess skilled physical therapy, they progress to a certain level, and they will hold that level after discontinuing therapy for 6 months, and you really see drop off in that 8 months to a year. And so typically when we would get the patient back a year later or 2 years later, we would see a decline in their physical function and their ability to partake in the aspects they enjoy in their life. And so we started the exercise program and we offer that free of charge to our multiple sclerosis patients to maintain their physical levels. And there's different aspects to it. There's a center-based program, and so people can come in 2 or 3 times a week, and we can provide encouragement, provide exercise correction, and exercise prescription to get them achieving their goals that they want to achieve. And then there's a home-based program, so people who feel they are able to do things well on their own, or if they live a great distance from the institute, then we can have them come in once a month or once every 2 months just to refresh their program, and we can in the meantime contact them by phone to make sure that they're staying on task and doing the things that we need. And we started this last year, so hopefully we will see them maintain their physical strength and the balance improvements that they made during therapy. We do have some individuals come into the exercise program that have been with us for a long time, and we have received a grant from the Christopher Reeves Foundation to get the MotoMed, which is a machine that will help patients exercise. And they can do that as like a bicycle, and there's also an arm attachment as well. So that's been a great benefit, and very appreciative for our grant from the Christopher Reeves Foundation.